Hi, I am Dr. Sangeeta, Pediatric Consultant, Aster RV Hospital, Bangalore. So, as part of Breastfeeding Week, I am just going to tell you about few myths about the breastfeeding. As a pediatrician, all of us recommend breastfeeding from birth, immediately after birth, till they are 2 years of age, because your brain development maximum occurs during this period. Unlike other organs, your brain development is in the first 2 years of your life. So the common myths which we usually come across are, the first and foremost is, most of the mothers will tell us, doctor, I am not able to produce enough milk. So there are hardly any conditions where there is not enough breast milk production because of the lactational failure. Okay, so there is no such condition that you are not able to produce the enough milk. So to produce the enough milk, the complete emptying of the breast itself is a good stimulus for your breast milk production. The second commonest myth I usually see in mothers is the cow's milk. So most of them say, yeah, even the cow's milk is as good as or even superior to the human milk. I would rather say cow's milk protein allergy is very common. About 10 to 15% of the babies can present with cow's milk allergy, and 1 to 2% can have a severe manifestations because of that. So better, rather than giving cow's milk, your AAP, American Academy of Pediatrics, recommends 1 year of only breast milk feeding. If at all there is a contraindication, you have to go for the formula feeds rather than the cow's milk. Okay, the third most common myth is, being working mother, it is very difficult to feed their babies. Then I asked, like, it is just 2 years you have to feed them, and the first 6 months are where you have to give the exclusive breast milk feeding, and you can express the milk. There are ways to store it. You can definitely feed if you are determined. The fourth most common thing is, like, I have to take medications, I should not feed the baby. Again, if you have any serious illness, you can consult the doctor whether these medications can be taken or not taken. Otherwise, simple medications like paracetamol can be taken during the breastfeeding. Okay, so there are no major contraindications for any medications, but still you have to consult your doctor and then continue with the breastfeed. The fifth most common is food taboos. I have seen, like, many parents come asking whether I can eat this food, that food, whether it is recommended during the breast milk feeding. Actually, as such, there is no definitive, like, you have to avoid this or that food, but definitely you have to avoid the junk. You should drink enough water, enough milk. Otherwise, you can have your routine meal, what you were able to eat before, but definitely the quantity and the quality should be good. Okay, then sixth most common myth is, I'm not supposed to feed when I am sick. Again, very few conditions, some infections, they say not to, breastfeed, but otherwise a routine condition, routine cough, cold and all, they are not at all a contraindication for breastfeeding. So to conclude, I feel breastfeeding is the birthright of a child. No child should be refrained from breast milk, and as a part of department of Aster RV, we all promote exclusive breastfeeding for the first 6 months. If you have any queries regarding this, you can always approach us. Even we have a lactational consultant here, and we are always there to help you. Thank you.